Hi, everybody. I'm going to present on plica syndrome. The articles I'm going to present is an imaging article on plica syndrome and bilateral osteochondritis dissecans from the October 2019 JOSPT journal. So this is a musculoskeletal imaging article. The patient is a 13-year-old male basketball player with chief complaint of left anterior lateral knee pain. The pain began 4 weeks earlier without trauma. It becomes worse with basketball, better with rest. He has full range of motion on exam, negative ligamentous tests, tendon tests, no effusion, positive Houston plica test, medial patellar plica test, and plica stutter tests were all positive. So those are really all special tests that really help to catch a plica. So like the key clinical findings would be like pinching, grinding, or like a pop. Suspicion of plica synovialis, and because of the suspicion of that, an MRI was recommended. Let me move this. The MRI revealed infrapatellar plica inflammation and osteochondral lesion of the lateral femoral condyle of the left knee. This is described as juvenile osteochondritis dissecans. The location of the pain is important here because it suggested that the knee pain was from JOCD and not plica synovialis, because plica synovialis usually occurs across the medial region, not lateral. So that was a significant finding. Most kids with JOCD have bilateral issues. So because of that, an MRI was performed on the opposite asymptomatic side. The MRI scan on the asymptomatic side did show OCD lesions of the lateral femoral condyle of that limb as well. After 6 months period of 34 visits and sport intensity, gradual increase of sport intensity, running but no jumps or sprints, the pain slowly resolved after 6 months. A follow-up MRI revealed no progression of the JOCD defects in both knees. This clinical imaging case suggests that the bilateral involvement of JOCD should be considered in cases where unilateral symptoms are present, because in this presentation it's likely that both limbs are experiencing these symptoms. Early identification of JOCD by proper imaging and conservative management do both have very positive outcomes. So I thought it was an interesting article, not things that you see readily in our practice, but I thought it was interesting to note the location of JOCD versus plica synovialis and the importance of early conservative management and the fact that it's important to get the bilateral MRI scan. Okay, the next one, which I was excited about, was linking lifestyle factors to complex pain states. 3 reasons why understanding epigenetics may improve the delivery of patient-centered care. So this was a super complicated article, very hard to understand, to be honest. I tried to kind of dull it down for myself as much as possible, but it was really interesting, but very heavy on like molecular terms and things that we don't really cover day to day in our practice. So epigenetics are mechanisms that influence how a gene is expressed without changes to the DNA itself. So cancer development and progression are strongly influenced by epigenetic mechanisms. So far, cancer is the most widely studied disease, and epigenetics influence on that. This article shows the possibility for epigenetics influence on orthopedics in the future. So DNA cancer cells are often hypomethylated, which links to increased tumor growth. Hypermethylation in genes is encoded for tumor suppression. So hypomethylation causes increased tumor growth. Hypermethylation activates genes to cause tumor suppression. New drugs are currently being tested to reverse epigenetic changes that might promote cancer progression. Long-term use of opioid medication increases global DNA methylation, which in turn is associated with chronic pain. So that was something that was significant for us. Just knowing that someone's been on opioid medication for a significant amount of time will likely predispose them to chronic pain. And they're likely taking these opioid medications because they're in chronic pain. So there's a self-serving cycle. What I found really interesting and quite upsetting was stressful events in infancy and childhood, like low maternal care in infancy and abuse and trauma in childhood, increased methylation as well. So they cause the genes to have a different effect than they would if the infant or child didn't sustain this trauma. The field of epigenetics has not yet had an impact on the field of orthopedics yet. However, epigenetics may directly help and help people understand fibromyalgia more. 900 different genes are differently methylated in these patients. So this is where epigenetics and biomarkers, which I'll explain next, can really come into play in terms of identifying more correct treatment for patients with fibromyalgia. So 3 ways epigenetics can help us clinically. They promote mechanism-based clinical reasoning by improved understanding of pathophysiology and the actions of their treatments. So basically, they understand the cause of something, and then because the specific cause of that on the gene level, hopefully you'll create a more specific treatment for that. It might help to subdivide patient groups and therefore allow for more targeted treatment and interventions if you can see how the gene is expressed through these epigenetic tests. And you can use a biomarker in the blood to monitor effects of environmental factors and lifestyle interventions like exercise and health. The reason why biomarkers are so helpful is they're helpful and should be used in the future, and there'll likely be a place for them in orthopedics. Blood biomarkers is a priority in these fields of rehab because they are more stable than other circulating biomarkers like serum, plasma, and are more influenced by environmental factors. So not only are they more stable, then they're more influenced by other factors that, in our practice, directly affect a patient's recovery. And that's it.